Wellness Wednesday with Dr. Bradley Meyer at the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave.
Well, we are going to talk about gut health today. That's a pretty important thing, and you have discovered, I know you have been researching this and doing a deep dive into gut health for a long time, but you're finding out more and more.
The discovery, every day we unpack more. It's endless, honestly. And, the big word that's passed around over the course of the last 5 years is the microbiome, and that is that the flora, all the different organisms that exist in your digestive tract, from your stomach into your small intestine and further.
Yeah, and you've done a deep dive here, and you have found out, and we've talked about this a lot in testing and lab testing. Not all lab results, not all medical tests are created equal. Sometimes a lab test comes back, everything looks A-OK, it's within the range that it's supposed to be within, and yet there's still some underlying issues.
Very true. And so, again, we're always grateful that we have some of these ways, such as endoscopies, which is commonly known as an EGD. Many times I'll have folks that come in with a history of epigastric pain or pain in their abdomen or what they call their stomach. Maybe they've got brain fog, fatigue, they've got loose stools, they're constipated, but the next step typically is either to start a heartburn medicine, which is an antacid and blocks the production of stomach acid, and eventually to have a scope to look down. Unfortunately, many times, those things they do a biopsy typically, but if you're going down there and you're identifying that there's nothing grossly abnormal, that's always quite reassuring. Unfortunately, many times folks then they continue to go down the path. Maybe they get a CAT scan and they also see, well, there's nothing that is obvious for the cause of the symptoms. And so from there, many times folks are coming into our clinic and they've been dealing with digestion problems for a few months to many years, and that's become their normal. And they've just been told that they've kind of adapted. And so, but what I've come to realize, and partly through my own journey, you learn from your own health journey and experience, along with our guests and patients that come in. But the tools that are out there to look at what's happening with digestion are getting better and better. And these tools are a little bit outside the box. They're typically not recognized or done by like your gastroenterologist, for instance, but they can provide some very powerful insight into our path forward. And that's where we've really been starting to dig in as another foundational piece. When we look at somebody's health and wellness, we're trying to find where the stress is at on the body, and if the stresses might be several areas of the body, but many times it is digestion and in things that impact digestion, like certain food intolerances that we need to explore. We've found a way now to identify almost like a personalized fingerprint and path forward for an individual. So in the past, you kind of treat what it's called empirically based on their set of symptoms, but now we're able to get more targeted in therapy. And Molly Avery, she's a gut guru. She's incredible. She's our functional nutritionist, has really been taking a deep dive, and she's brought me along with and discovered some powerful tools to again identify that personalized path for somebody. And from there, we can do targeted therapy that is specific to that individual. So, we have an individual that comes from a young little girl that comes from South Dakota, and she missed so much school this last year because of abdominal discomfort, and was told that she had functional abdominal pain, which is basically they couldn't find a reason. And she was hospitalized, all kinds of testing, scopes, imaging studies, and the poor little girl got to the point where she just was afraid to even eat, because every time she'd eat, it would hurt. And so then you get into this cycle, And we did some testing with her and found out that she had H. pylori. Now, the H. pylori came up negative on the endoscopy testing, and we found, a different lens to look through. And so, like we talk about, sometimes I still will treat with antibiotics. We did for her. And then we've done some supplements, some different approaches that way to help repair that digestive tract and work on the H. pylori. H. pylori is a bacteria that can cause trouble, and a lot of times if you are in a low stomach acid environment, many times folks that belch a lot, burp a lot, have heartburn are actually in many times a low stomach acid state. And so what happens if you don't have enough stomach acid, you can end up having these opportunistic organisms take foot in the digestive tract. So it can be candida, it can be parasites, a whole host. It can be staph, strep. So then it's the decision of, when we give this decision to folks, do we want to treat it with a traditional antifungal or antibiotic, or do we want to go more of a homeopathic or a supplement route, which also can be quite effective. So, but in her case, happy story. We treated, and she's met with Mychal to work on some reflexive brain work, worked with Molly, worked with myself and our team. We've got her headed in the right direction as we come into the summer now, no longer complaining of stomach pain every day. So we still have some work to do to rebuild and repair, but an extraordinary example of, she had been 6 months of exhausting and ruling things out and still stuck in a position where the parents were quite desperate. And so very exciting to know that we've got some different ways from a digestive perspective. And we do have specific testing that we do, Dave, that is very pointed on food sensitivities and very pointed on what is that environment look like in the digestive tract.
Yeah, and it's pretty amazing, the food sensitivities that are out there. And maybe it's because we have such a wide range of offerings for our food these days.
Well, a lot of our foods, the more processed it is, can create some trouble for us. There are a lot of things from our food that it doesn't have the nutritional value that it, in many cases, it used to. So you have to be very good at trying to do the best you can to source that food, eat whole food based the best you can. But yes, it's many, believe it or not, even things we don't even think about can affect the gut and the microbiome. Something like as simple as ibuprofen, for instance. Mm-hmm. Ibuprofen can wreak havoc on the digestive tract and lead to what we call a leaky gut. So you can count heavy metals can have an impact, microplastics can have an impact. We always talk about poor mitochondrial function, that can have an impact. You can go back to childhood trauma, stress can have an impact on that digestive tract. So it's really, and then folks that tend to want to crave a lot of sugar, that might be an indication that they've got a candida overgrowth in there, and some of the testing that we do can identify that, and then we direct some of that therapy in that way. But it's so cool to put together the story, because I can look back to myself and say, oh, what does Dr. Meyer's journey look like? And I've always been working through digestive symptoms from the time I was at the emergency room in high school at Lakes Regional Hospital. I ended up getting a CAT scan because they thought I had appendicitis, horrible abdominal pain. I look back to that time. I used to have horrible heartburn and belching even in high school, and that goes along the longer. Then I went on a heartburn therapy, a PPI, like Leprozole, for 25 years after that. It had an impact on absorption of my iron. Then I ended up on a restless legs medication because I developed that after that. But you can start to identify and put the pieces together when you do this testing and say, oh, that's there. I'm low on stomach acid. Oh, wow, I've got H. pylori, and my H. pylori is probably elevated because I've had low stomach acid all these years. So how do we get that stomach acid back online? So we can help with supplements, but eventually we want to get it back online so we're making it ourselves again, so we don't have to depend on the supplements. But it's super, super cool to do the detective work on these folks, and you can look at little inflection points over the course of their history and identify, ooh, I bet that impacted their digestion. Oh, yes, that That probably was a factor. And then you put the journey to kind of get things rectified. Of course, we always talk about you have to avoid what is the trigger, and many times it's identifying that particular food. And so we avoid it for a while. In some cases, we are able to reintroduce that food. But if we're not avoiding it for a while, that can continue to irritate the gut. So we have to identify what it is that's triggering the digestive distress. And then what do we do to help? We always talk about like a garden in the gut, and we have weeds in it. And sometimes and we have good vegetables in that garden. So we want a good balance there. And so that's what we're attempting to accomplish over the months, is to really get that space into a space of balance.
All right, we got to run here. One of the things you talk about often, and interesting, Dr. Molly James talked about that this week. And since the beginning, you've talked about this, is if you have a provider that's not interested in finding the root cause, you need to keep looking, because at some point, and you too have talked about this, sometimes a Band-Aid is indeed needed. But at some point, you got to try and peel back the layers of the onion, as you like to say, to find the root cause of what the issue is.
And absolutely, if we're in a space where we can spend time with our guests, which we do, it allows for that point of discovery. It allows us to go back and peel the layers off in a non-rushed setting. And so that's what my colleagues many times are up against, is 7-minute visit. And for us, we're not in that case. And that is another impactful reason as to why we can make headway. So.
Yeah, why you can get some of that discovery made. All right, if anybody wants to visit with you, Dr. Meyer, tell you maybe a little bit about their journey, say, you know what, I'm just surviving the day, I'm not thriving the day, and I would love to thrive throughout the day, how can they make that connection?
Yeah, so, I mean, if specifically as it ties to, if you're like, yeah, this kind of makes sense to me, the gut and things like that, think about some of the key things. You don't always have to be having gut and digestive symptoms to have it be related to a gut problem, a digestive problem. So if you're one of the folks that say, I've got some brain fog, I've got some fatigue, I've got some joint pain, I've got this rash that just won't go away, my digestive tract is slow. Those are the kind of things that should get you thinking there could be a digestive component to it. So again, outside of the slow digestive tract, some of those other extra digestive tract symptoms, if those make sense, if you're like, yeah, a lot of times if we don't say, oh, it's directly tied to the gut, then it's not the gut. Many things tie back there. So if you're ready to specifically learn more, you could do a discovery call even with Molly and go through the entire gut process with Molly Avery, our functional nutritionist, or you can get started with me. We do the discovery calls, Mychal Sheridan, Molly, and myself, complimentary 15 minutes at 712-339-6024. And we all offer our own different perspective on approach to helping the body get into that space where it's finding balance and working on healing. And we work collaboratively together. So some folks decide that they want to meet with all of us and some individually, and that's okay, however you want to start. But that's complimentary, and we just answer some initial questions. If you're wanting to just get going, give that same phone number a call, 712-339-6024. And our amazing front team, Carissa, Shauna, can get you squared away. Typically that first visit's an hour long, and we'll give you a tour of the clinic and come up with a really good game plan for potential paths forward for you. And, yeah, it's a very gratifying journey to go on, and ultimately we want folks to feel their best.
Absolutely. I noticed, I don't know if you've had that up there before, but I noticed on your website now, you go down the page a bit, okobojewellnessclinic.com. There's a little tab there, request a free 15-minute discovery call. So folks can do it that way too.
Absolutely.
Yeah.
Give us a shout and start your journey today.
Very good. Dr. Meyer, always a pleasure. Have a great day, and we'll chat again soon.
Great. Take care, everyone. Be well.
Thank you, Doctor. Dr. Bradley Meyer at the Okoboji Wellness Clinic. Find out more, okobojewellnessclinic.com.